Hi, my name is Beth Hoag. I'm a physiotherapist working in cancer rehabilitation, lymphedema, and pelvic health. In this video, we're going to look at an exercise to help start restoring shoulder elevation or use of the trapezius muscle following a lymph node dissection of neck. If your nerve, the accessory nerve, has been completely severed or cut and not reattached, this is not going to be an appropriate exercise for you. This would only be appropriate for individuals who've had the nerve cut and reattached, and or if it's been retracted or stretched during the surgery. So I also want you to remember that this exercise should not be painful, not at all. It's certainly going to feel weak and awkward, but it should never be producing pain. For the shoulder shrug, I want you standing ideally in front of a mirror so you can see what's going on with both of your shoulders. We're going to stand with our palms facing forwards and arms straight out to the side. Next step is I want you to imagine your shoulders like you're in an elevator shaft. So in an elevator shaft, the elevator can go up and down, but it can't go forwards or backwards. And that's going to make sense in a moment. So imagine those shoulders like an elevator in a shaft. I'm going to have you inhale and slide those shoulders up, or imagine the elevator going up in the shaft. And as you exhale, we're going to bring those shoulders back down to the starting position. Now, when I say starting position, I don't want you to depress or lower the shoulders more than sort of your natural position. So just be aware of that. Inhale, slide the shoulders up. And exhale, bring the shoulders back. Now I'm going to have you keep going through that. And I'm going to turn to the side. So some common cheats that can happen is that elevator shaft is going up and down, yeah? Often when there's a weakness or there's been a disruption to the nerve after surgery, most commonly a neck dissection surgery, the pec muscle can start to take over. So what that would look like is instead of the shoulder going straight up, it comes forward and up. And that's the pec muscle trying to cheat and do the job. So I want you to watch out for that in a mirror, that the shoulder's not coming forward. The other common compensation is a pulling back motion. And that's some of these scapular rhomboid muscles that are trying to do the job instead. So really I want you to be aware that you're going straight up and straight down, not forward or back as you do this. The other thing to keep in mind is after these neck dissection surgeries, sometimes it's literally impossible to get that arm moving or get that shoulder moving. So even if you stand in front of a mirror in the position and do it with the unaffected side and imagine that that opposite, the affected side, is going with it, or you can even close your eyes and do it and imagine or visualize that shoulder going up and down. Now, I know that sounds a little bit crazy, but from the research, we know that there is carryover from the unaffected side to the affected side in terms of the nervous system. So even if you can't physically do the movement yet, going through it on the unaffected side and visualizing it can start to improve the nervous system, the communication between the brain, the nerves, and the muscle. Okay?